Dr. Christle Guevarra, how are you?
I'm doing amazing, especially now that this head cold situation has resolved itself. How are you doing?
I'm doing great. I am so excited that you're here. I'm an avid follower because you're so smart and your kindness also not everybody can actually shine through social media, but you do. And I'm so happy that you're here. So
Oh,
thank you.
I appreciate it. It's taken a lot of work to get to this part of my life. And I think if you would have said, I don't think you would have said the same thing about me even a couple years ago, but I'm glad I feel I really actually, when you say that, I actually truly believe that too. So thank you for,
Oh
you
my
know,
gosh.
it's taken a long time to get to this part. So thank you. Oh my God, I'm gonna already start crying. Jeez.
Wait, no, but like now I have to pause for a minute and
Yeah,
ask if you don't mind
of course.
explaining a little bit on getting to this point. Welcome to Bodyholic with Dee. No fads, just facts. I'm Dee, and I'm here to help you ditch the noise and build a life you love. Let's go. Oh, but wait, I'm not a doctor, so use your common sense. Now let's dive in. Like, who is Dr. Christle Guevara?
Because I have struggled with hunger and get this, hunger signaling food noise for so long that I've tried to compensate for it by doing all of these academic, things. Like I just sort of resigned myself to like this is the genetics I've been dealt with. I don't have, what it takes to be like or even lean. I feel out of control despite the fact that like, my CV says that like I have willpower, I can do things, like I've done some really amazing things on paper, but I just always felt like this diet part has been this like stain or this, chip on my shoulder for a very long time. And now that I have actually found a solution, like it was the one thing in the toolbox that like I didn't know the secret to, I have failed multiple times, that it has now allowed me to become like not just, yes, I have lost weight and kept it off and like all these amazing physical things, but I haven't been able to progress emotionally, mentally, showing up at work. I haven't been able to be my best self because I've always had this, thing that I've struggled with for so long, and it clouded my mindset completely. Just, no matter what I, tried to do, hired a coach, worked with different coaches, worked different apps, et cetera. So
Wow.
it's a lot.
No, it's a lot. It's a lot to overcome. It is a
Yeah.
lot to overcome because, you know, judging by what you've done and what you do, it's kind of like, how is it possible that this woman was was even knocking her down? That's
Yeah.
kind of, it's almost like, really? But it's one of those things that I guess you don't wear on your sleeve. And it's
No.
just, yeah.
Yeah. So, but yeah, and now that like we have data and studies that actually look into this concept of hunger and food signaling and food noise, I guess now I would hate to not share my story because for every, person who's like, you have no willpower, you're cheating, or whatever, bot, person hurls some insult at me. I can't tell you how many people have been in my DMs saying, thank you so much for your story. I'm on a GLP-1, medication and I'm really embarrassed to talk about it, or I'm thinking about it and I'm really embarrassed to talk about it. And like not having anybody to go to actually like and say that and ask for it and have an honest discussion about it that's guilt free. Just it would be, it makes me sad, and I would just hope that we could just be a little bit more compassionate, both the people who are struggling with it and coaches out there who do work on behavior change and will, ultimately, if they haven't already come across a client who is either thinking about these medications or is on a medication and we want to just make sure that like we're all on the same team. I promise you, nobody's trying to cheat their way through anything or whatnot.
Mm.
We all really want the same thing. So it would be very beneficial for us to kind of, come from a place of compassion and figure out a way to move forward with it.
Was GLP-1 the game changer for you?
Yes, I have failed multiple weight management medications in the past, prescribed by my physician, came with a whole host of side effects, and did nothing for my hunger. So
Mm.
I started taking this medication in January of 2022.
January 2022. So this has
Yeah.
been it's been a while.
Yeah, and
And what
yeah.
is it, like a daily dose?
No, it's a once a week. All of
Okay.
the GLP-1 agonist drugs currently are the half-life is about a week.
Mm-hmm.
So
Mm-hmm.
there is an oral pill that you could take daily, but you have like meal timing. It has to be first thing in the morning. Like I want to say that you have to like drink X amount of fluids after it.
Mm-hmm.
And sort of, it's a little bit more like, and it's also a little less effective than if you just bypass all of that and inject.
Yeah. So, do you want to
Yeah,
maybe, as a physician, kind of
yeah,
talk about GLP-1 and what it is?
yeah,
I actually went on a whole rant. I think we talked about this about
yeah,
GLP-1 and Ozempic and the fact that the research is really very impressive. Like
yeah,
it's just as I really I
yeah,
tried not to be impressed by it, but I was like, this is so impressive. So
yeah,
maybe like a few words about it from a physician, and that would be
yeah.
amazing.
Yeah, the GLP-1 is glucagon like peptide 1. It is a hormone that we naturally produce in our body, and the way it works is essentially you ingest food goes down through your stomach, churns, and gets spit out into your small intestine. And the cells that are lining the small intestine detect that food is coming down the hatch, so we need to like do stuff, right? Like we need to shuttle these nutrients to like do awesome things. And so the intestinal cells will release this hormone GLP-1, and it does a whole host of things. It tells the pancreas to secrete some insulin so we can utilize and shuttle the glucose that's going to get, made, from the food. It also, it also kind of sends up signals to, the brain to let you know, hey, I'm full. The problem with our hormone, like the native GLP-1 hormone that we make, is we also make an enzyme called DPP4,
Mm-hmm.
which is neither here nor there, will come and cleave off, manipulate the hormone. And then once it's manipulated, it's completely inactive. So these GLP-1 hormones, the typical half-life for these hormones that we produce is somewhere on the order of 3 to 5 minutes. Like that's not a lot
Mm.
it's not a very long time, right? Like to do, like it can only affect so much, do so much in the body with like that much release and that long of a half-life. So they discovered and isolated GLP-1 like back in the late 70s, early 80s. And so they, because of the fact that it signals in, the insulin release, they started working on this for decades to, like thinking about like a pathway to kind of for diabetes medications. And it wasn't until 2005 that the first GLP-1 agonist. So let me back it up. An agonist basically is something that will attach to the receptor very similarly, but this is able to dodge that DPP4 that like would come in and cleave. So the drug that that people would inject, it'll go through the bloodstream and actually attach to the GLP-1 receptor, which are on places such as the brain and also
Mm-hmm.
the pancreas to do the thing, right? Give me some insulin, give me, turn off this, pathway telling me that like, let me know that I'm full, but it
Mm-hmm.
lasts a whole much longer than, what our bodies can naturally do. It'll last a full week. So,
Right.
um, so agonist essentially will allow the signal, allows the signal to happen, and actually, yeah. So the first drug was discovered and FDA approved in the United States for type 2 diabetes in 2005. So
So it
we,
took a while.
right, it took a while, but also we've been using GLP-1 agonist drugs since, it's what, 2025
20 years.
for,
Yep,
yeah,
20
it's been
years.
20 years. And so it wasn't until like the 2014s 20, that liraglutide, it was a next generation of the, drug
The
that
diabetes drug.
the dry diabetes drug that they also noticed that there was this like side effect of like weight loss that was happening because very early on with the very first drugs in the early 2000s, the weight loss component was really not that impressive.
Mm,
The studies, it was like somewhere on the order of like 5 to 6 pounds. So it was just like meh. And so as they kept improving on the, you know, uh, so 2014 is when they first start, the FDA in the United States approved it for chronic weight management.
right.
So not too many people were on it. It was still a daily injection because the half-life
Ah,
wasn't as
okay.
long. And then it wasn't until like 2017 that semaglutide had come out. It was lasted a week, and the weight loss effects were very, very dramatic. And so I think a combination of you have that dramatic weight loss effect and you have, that satiety part was really dialed down. But then you also had social media. We didn't have social media. Like social media in the early 2000s is not like the social media of like 2017, 2018 with TikTok, Twitter, Instagram, so
Absolutely.
and so you've got a lot of people barking about it and having, expressing their feelings about it. So as a physician, I have been very familiar with both the chronic weight management side and also very early on with dealing with, treatment for type 2 diabetes. So I'm very comfortable with it. It does a great job of lowering the A1C.
Hmm.
And then, nowadays it's more along the lines of, incorporating it into an overall game plan for weight management because this is a lifestyle, there is a very huge lifestyle component to, managing weight. So, and it's not just taking the drug and then like see you later in 3 months.
Right. Exactly. And those who take the drug and see you later in 3 months, I think that's kind of where the noise comes from.
Yeah.
Am I right? Yeah. Can you
Yeah.
say a little bit about that and why it has to be really the two, the Ozempic and or whatever drug, right? Because it's not only Ozempic, if I'm not mistaken now.
Yeah, yeah. There's now a dual agonist, tirzepatide, which
Hmm.
not only is a GLP-1 agonist, it's a GIP agonist. So it's a dual agonist. It has the data for tirzepatide for not just the weight loss component, but also reduced cardiovascular risk, improvement in fatty liver disease and those, and then also with kidney disease, like that are aside from that are independent of weight loss. So it does make it a lot more attractive as far as like if you had to pick one versus the other. And also anecdotally, I do see a lot of people who have problems with the most common side effects with semaglutide seemingly faring a lot better side effect profile wise to that, when they switch to tirzepatide.
Mm. Um, Speaking of, what you're seeing and
Yeah.
in the field,
Yeah, yeah.
I'd love to know, especially like if you're looking at colleagues and seeing what's going on over there. I'm interested also if you think that there are people who are too quick to prescribe medications. Um, like, what if, how do you approach the lifestyle? What if the lifestyle interventions aren't really fully explored? So what's going on over there?
Yeah, and I think it's, I think it's, I guess, trying to understand from, I don't do a traditional brick and mortar practice. I don't work for a major healthcare company. I am not paid by the pharmaceutical industry to speak upon this. So I do realize that I have the freedom to kind of practice how I want to, that not every provider is able to, because it really is, I got to give the physicians a lot of credit who are working in major healthcare corporations. Um, it's a grind. You got
Wow.
15, you got 15 minutes, and like it really pained me to try and figure out how to, like, I used to try and incorporate some lifestyle stuff. Like I remember doing like some wall push-ups together with one of my patients to like, and I'm trying to do this in 15 minutes, right? Like, and then I've got this line of people, in the waiting room just like pissed because because then, you don't want to kick people out, but then they're like, I have this one more thing. So,
Oh,
so
yeah, it's
I
impossible.
it is. It's difficult. So, and I think the lifestyle part definitely gets missed. What I would really love to see, and I'm starting to see this more with now that everybody's really taken notice of, how powerful these meds are for weight management, where they are doing a lot more collaborative process with, having a dietitian, having a health behavior, wellness coach, having a strength and conditioning coach to kind of come in and like be able to outsource but like if you are in your, again, a regular family medicine or internal medicine where you're not just dealing with weight management, you're also
Hmm.
seeing, all sorts of other medical, issues. It's really hard to coordinate all that. If especially if that's not the bulk of your practice, is like just this.
Right. The it's important that the person who's going for it has to be, you know, what can we do? We can't educate the people who don't want to be educated, but maybe the doctors, you know, maybe they can be educated. And the first thing should really be what you're saying, like, let's go for the holistic route, for the dietitian, for the well-being coach, for a personal trainer. That would be ideal.
Right.
uh, I almost want to say, like, maybe that's what the pharmaceutical companies have to start providing, like, to just like, here's how we do it really safely. And
Right. Right. Yeah. So I 100% agree. And the thing is that and I think it would also be a little bit easier for people to be monitored, kind of a lot more closer. Because there are people, sometimes it's like, come back in a couple of weeks. So much has happened in a couple of weeks that you can't, and I understand it's not realistic every day checking in, but I think once a week checking in, I think the mode and delivery in which healthcare is being delivered is also has rapidly evolved, especially after the COVID pandemic. People realize that, like, I don't want to have to like get in my car, drive to the doctor's office, sit in a waiting room while they're running late. It's a waste of people's time.
absolutely.
You know, and I say this as a physician and a patient, right? Like I hate having my time wasted. So, um, and I know that sometimes with the reimbursement for a telemedicine visit has its own like special kind of requirements from the billing side of things, which also further complicates things, and it makes it harder to provide great care when the insurance companies, um, you know, don't always want to pay full price for a over the phone visit or a Zoom call versus like having them dragging them into the office to talk about stuff.
I just have to pause you for a second
Yeah.
because I lived in the States for some time.
Yeah.
And I am in Tel Aviv right now.
Yeah.
One of the driving forces to me returning home
Yeah.
was
Oh
the
no.
insurance,
Oh
the health
gosh.
insurance. Like, what you're describing to me right now is
Yeah.
a non-issue where I live. It's a non-issue.
Yeah.
Okay, let me, I mean, I'm
Yeah.
gonna,
Yeah.
to my American friends, I'm gonna blow your mind right now. The other day I had like a red dot near my nose and it was kind
Yeah.
of itchy and
Hmm.
uncomfortable. It's just because it's so bloody hot here. Like
Yeah.
it all of a sudden became so hot.
Yeah.
Um, but I was worried. It was like, I was like, oh my God, what is this? Like a herpes fungus kind of, I
Yeah.
was exaggerating. It was really just a red dot.
Yeah.
But I got on my insurance that
Yeah.
everybody has here
Yeah.
and I called a skin doctor
Yeah.
and got him to look really close got into the camera. And I was like, what is this? And he was like, it's really nothing. And I was like, okay, thanks.
And then that
And
was
that was
it.
it.
Yeah.
So, like, what you're describing to me right now is just unbelievable. Unbelievable. There's going to have to be some kind of revolution.
Yeah. I don't know what this, I wish I had an easy solution for you, but right now, yeah, I know that there are some providers who are just going all in on weight management and like, and I think that's actually great. I think, you need to like be able to focus on it because it's so intensive having to work with patients or clients on, the lifestyle portion. It's so important. And you can't do that in a 15-minute visit once every, month, once every 3 months.
Right. And actually, it really is, smart insurance wise, like to take care of these people while they're actually healthy
Right. Then
before they get to the metabolic syndrome.
exactly. Exactly. And then we're trying to play catch up here. But the way it works is it's really easy to get these drugs approved if you have type 2 diabetes or even pre-diabetes and then get the drug that way versus trying to, got a prior auth approval for a patient's weight management drug, and the copay was still like hundreds of dollars. And it's like, why are we paying insurance if she still has to basically pay almost full price for this
Yeah.
drug?
Mm.
Yeah, yeah, I'm with you.
Oh, yeah.
Yeah.
It's a pain. It's a painful issue.
Yeah.
Speaking of painful issues, what do you think? And I'm also asking you, Crystal, the person,
Yeah.
um, what do you think are some of the biggest psychological or behavioral barriers that you see in patients that are trying to make lasting health changes? So like we're talking about
Yeah.
lifestyle now.
Yeah. Yeah. And I think it really depends. Like, I know that we're kind of in the fitness space. So when I'm looking at like the general population, I think just even desire to even start, like they don't see that they have a problem. There's no, especially if you don't already have diabetes, high blood pressure, high cholesterol. If all those markers are normal, there's a lot of people who are just like, yeah, this isn't important to me. Like this, I don't see what the problem is because there are no problems right now. Um, and so it's hard for me to, I can have a conversation and I can try and broach that, topic very gingerly, depending on, how they react to things, because that is a very sensitive topic, right? And you have to get that trust and buy-in, and I don't always get that. That's one. Like I just, we're in pre-contemplation mode where like
Yep.
nothing is a problem.
Mm-hmm.
The other things are, things that I've seen with other patients that not necessarily to my practice that taught me what I needed to do up front is I think having a discussion about body composition is important. Having an honest discussion that the scale is just one tool in the toolbox and doesn't tell you the full picture. I think those are, and then also, making sure that when you're checking in, not just focusing solely on like did you, what does your weight look like? Did you get your steps in? Did you like hit all your meals? But, what are some new thing like what's a non-physical way that like this journey has like had like what kind of an impact has that had on you? Have you noticed that you interact with the world differently? Have you noticed the world interacts with you differently? So getting a, kind of a sense of like it's more than just that. It's like changing the mindset of of like now I'm a fitness person because these people don't I usually when they start they don't identify as a fitness person.
Right.
They see, normal body to lean bodies and they're like, I don't look like that. I don't know if this is, it's very overwhelming to me. I don't know if I'm ever going to get there. And those are all very valid. I've felt those, as myself and
Hmm.
so trying to coach people and making sure we have that talk about body composition, especially early on, because I've seen a lot of patients diet themselves down to a number. And then they're like, oh, I'm, super like skinny with no muscle. And then I got to build muscle, which is, it happens. It's totally fine. And depending on where you start, where you like I would rather have that than have somebody not start at all. But I mean, if you
Hmm.
can do it in a slow sustained manner, like I'm all for that
I
journey versus
really, yeah, no, no, no. I
yeah,
agree with you. I'm a manning everything you're saying because body composition, as far as I'm concerned, is so much more interesting to me
yeah,
than the number on the scale. And I don't think everybody can afford a DEXA scan,
no,
but you could even just use the mirror to just like, are you
take a picture.
standing? Yeah,
Yeah, take a
that's
picture.
actually what I do in my studio. I
Yeah,
take like a really bright, unflattering picture,
yeah,
with
yeah,
lots of light.
yeah,
And then we come back in 12 weeks and we do it again. And I
yeah.
don't have a scale in my studio, actually.
Okay.
It just like I really I don't mess
Yeah,
with it. I'm not a dietitian. I train people,
yeah,
and uh, my most my biggest thing is just lift really heavy, lift weights, lift
yeah,
weights, lift weights with perfect form, and it's all
yeah,
gonna be okay.
yeah.
Like also like if you're angry and stuff, lift weights and it'll be okay. I
Yes.
mean, it's just it's the
Yeah.
solution to everything.
It is. And there are other coaches who do once a month check-ins or like not over indexing on the scale every week, which I
Hmm.
think is also great as well, right? As long as there's like some sort of, check-in that's a little bit
Yes.
more like, obviously you're not going to just be like, let them go for a month and be like, have fun, see ya,
No,
come in, right?
absolutely.
So yeah, I encourage to take the pictures because it's sometimes when you're seeing yourself day to day, you don't realize how far you've come. And I think also as a physician and as a coach, reminding your patient or your client about how far they've come or reminding them, like of the little wins. Like I have a patient
100%.
who went to the gym, but also invited her, she invites her daughters to go train with her because they want to build muscle. And then she invited her friend. And I told her, that's really awesome. You are becoming a fitness person. You are incorporating this and
Yes.
you're bringing your social network into it. Like that is super awesome. And I love to see that, right? Like you are changing as a person, not
Yeah.
just the body part.
The identity thing is really, really important. Like
Oh, yeah.
once you start identifying as whatever it is that you want to
Right.
be,
Right.
that's what you are.
Right.
Like it becomes like the future becomes the now.
Yeah.
I have to just stick with this with
Yeah.
the BM with this.
Oh, God.
Yeah, I've got to stick with this for a second
Yeah.
because I have to talk about skinny fat
Uh-huh.
issues.
Hmm.
Because you just mentioned the body composition, and it
Yeah.
really, I have to say
Yeah.
that the high body fat percentage, low muscle mass, and
Yeah.
the low or normal BMI
Yeah.
is really an issue. Like I want to just you mentioned it. I kind of want to surface this. This
Yeah.
is really an issue. This is a lifestyle issue,
Hmm.
and
Hmm.
even though you walk around thinking that you're really skinny
Yeah.
and like great, so you're at risk for um, low bone density.
Mm-hmm.
You're at risk for having excess visceral fat, which means like, fat around your organs. So you could,
Right.
have all kinds of metabolic issues. So I'm interested in now,
Yeah.
like, how do you address a situation like that? Because that's really hard. Like in terms of mindset,
Mm-hmm. Mm-hmm.
trying to get someone to like understand that it's not ideal and it's not optimal for their health and longevity. How do
Yeah.
you go about that?
Yeah, that's a great question. I'm glad you touched upon the BMI because I think one of the most common questions I get on a podcast is say you have somebody with like a normal BMI and they just want to lose the last 5 pounds. Like, what would you do? And I'm like, it really depends. It's not a automatic no because of the BMI. Like you said, all those other things do matter. And
Yeah.
I think it really starts with what is actually important to them. And then kind of building the case, like, the potential risks down the line and kind of going from there. And if it really involves a nuanced conversation that I never feel really comfortable saying, well, yeah, this is how I would approach. But I do like the idea of figuring out like who that person is. Are they a grandmother who, is living their best life, wants to be around for their kids? Is it a mom who, or a dad who like wants to be around
Yes.
for their children, and kind of taking the bits and pieces of osteoporosis risk, heart attack risk, stroke risk, and then kind of weaving it into there. So I like to see where they're at emotionally and mentally and what
Mm-hmm.
their life goals are and kind of tying it to that. Because it's not always about I want to look this way. And sometimes it is. And then you have to have a conversation about, muscle is what is actually going to, give you the shape that you are
Yeah.
probably looking for.
Right.
So I do keep some like, fitness people in, and kind of like if we are going that physique, route,
Mm-hmm.
kind of showing them like what are you looking for in terms of, physique, and then having to explain how important muscle is in the equation.
Right. Like I want my jeans to fit nicely. Well, there you go. You've gotta lift weights.
Right. You've got to, yeah, it's not, not everybody bought their, had got a BVL and called it a day. So, you know, and those aren't like, you can still like, if you're not weight training, those results might not be as lasting as you would expect, especially as the
Exactly.
muscle starts to shrink over time.
Right. Right. The what would you say is the number one, and not working out, specifically not working out, the number one daily habit that maybe you see with yourself or you
Mhm.
even recommend that really is a game changer? So not GLP-1 and
Yeah.
not working out.
Oh, between the two, or do you want me to
No,
pick a third one?
I want you to pick a third one.
Oh, I mean, definitely meal prep. Learning how to cook and
Boom.
preparing ahead of time is
Nice.
like that is it. Yes, I think training, I would go insane if I have gone insane taking a couple month hiatus off of training, but definitely because I feel like a lot of people out there in this world kind of just react. They like whatever, I'll go to Starbucks, grab, a Frappuccino and like a pastry and like call that a meal. And then I'll just, for whatever for lunch, I will go to some fast food and pick up something. And then,
Yeah.
because I don't have time or I don't want to make time. But see, that's also a really good point of, when people do bring that up, I will pull up the menu and we will go through some healthier options as well, because I do think it's important to like, not everybody's trying to be a bodybuilder. So you don't need to eat dried chicken breast and broccoli, steamed broccoli and white rice. Like that's also just, I mean, if you want to, you can give it a shot, but most people are going to be like, ugh, gross. So I
Right.
think, You can eat on the run. It's not the ideal thing, but what's the alternative? You eat crappier food with no protein and just carbs and fat.
Right. I have to say that like even prepping, like looking at the menu prep,
Yeah.
just you know what you're going into the restaurant with. I think that's
Yeah.
so powerful and I think it bypasses the willpower thing. So, of course, when you actually prep and you have the containers
Yeah.
and it's all like laid out and planned out and you really don't have to think,
Yeah.
that's amazing in
Yeah.
bypassing the willpower.
Yeah.
But then, that's also really understanding the menu, going through it with your patients or whoever you're working with. I think that's
Yeah.
amazing.
Yeah.
And I think more and more fast foods are offering,
Oh yeah.
the healthier option,
Oh
right?
yeah. Yeah. Oh yes. There's two sides of that spectrum because I did just see I think it was either Domino's Pizza or Little Caesars Pizza offering a mac and cheese pizza with like a sausage roll embedded into the crust.
No, right. Okay, folks, this is only in America.
We are undefeated with the fat but the other thing is the fast food companies will continue
Okay.
to provide what we buy, right? So clearly they think there is a target demographic out there that really will find this appealing and they will
Right.
cater to it. So
I just kind of lost my lunch a little bit, but yeah, yeah. I'm not judging. Hey, if that's your thing, cool.
yeah.
I just can't, you know?
Right. 100%. I also think that people over index on it's the companies are malicious and they're out to get you. No, they really want you to buy their product. They think that this is genuinely what you are willing to pay for and enjoy.
Mhm.
And so here you go. If nobody buys it, it's going to 100% going to get off the shelves like ASAP because it's not in a company's best interest to continue offering a crappy product that no one wants to buy.
Yep. I would
So,
even, I've actually lectured on the topic of there is, the companies, there's
yeah.
the consumers. I want to talk to the government.
Yeah.
Like I
Yeah.
actually let's put those two aside and I want to talk to the government about how they regulate and how they educate and et cetera, et cetera. But that's a topic for another
Yeah,
day.
that's a topic for another day. Yes.
um, is there anything I have I
Yeah,
before I actually give you the freedom, I have one thing that's just kind of
for sure.
sitting in my head.
For sure.
And you'll soon see why I'm saying no pun intended. But the deal with leptin, okay?
Mm-hmm.
I'm
Mm-hmm.
like wondering why nobody's talking about leptin with the GLP-1. Does GLP-1 basically cancel out the whole leptin situation? I'm just going to explain that leptin is the hormone that signals satiety.
Yeah, so that's a really great question. The and I my hypothesis
Hmm.
is that the leptin is completely removed from the equation. I know I have read that studies where they had been working on the leptin pathway as like a way
Right.
to, you know, kind of tackle those drugs. But it also, leptin, correct me if I'm wrong. I completely like lost my had a brain fart. Leptin also deals with like thermogenesis, like how, your neat how
Uh-huh.
um and so if they solve the leptin problem, um I would say that like all of this part is solved and the last thing that they need to work on is building muscle, which I know that the myostatin inhibitors are kind of coming down the pipeline, at least in research.
Hmm.
So I don't think we're that far off from actually solving this entire problem altogether of like this lack of muscle mass, whether it's you want to generate that signal on your own or take some medication to solve that problem, which definitely rubs people, some type of way. But I think we're, the people who are able to adapt, because I think we are going more than ever, despite the fact that we have these drugs down the pipeline, we're still going to need people to talk to, like human connection. That's still going to be important. to a lot of people. Having that sense of support outside of just like inject and like, by themselves. So I don't think
Yes.
that, coaches, personal trainers, I don't think that they're going away. Like, you guys, like, people should not be scared of this. They should just view it as another thing, tool in the toolbox. And if you can't offer, community or support or something else other than macro counting and like sending programs, then maybe, it's time to pivot your career entirely.
Yes, yes, absolutely. Like that, you know what? I feel like that's actually that's a great way to actually wrap up.
Oh,
Um, like I could go on about, I could really expand on almost everything we touched
yeah.
on. The leptin, by the way, is something that I find so fascinating. And I really got into the whole period of time between ghrelin and leptin. I'm just going to also explain that ghrelin
Yes.
is a very interesting survival hormone that basically,
Yes.
if you haven't eaten for about 4 hours plus,
Oh,
it'll
yeah.
start telling you that you right now have to eat a refrigerator. Now, that's what it's basically telling you.
Yes.
And,
Grr, hunger.
right. And then the leptin is like the other guy who says, okay, I'm full. Once your body fat percentage goes up, also the leptin, if I'm not mistaken, uh, goes up.
Hmm.
Um, I was always wondering, like, how how is leptin not the big thing? And then, all of a sudden I'm understanding that there's this whole GLP-1 thing, which the GLP-1, they don't even, nobody mentions even leptin. So, but what
Yeah.
you're saying actually is something super interesting that I didn't understand,
Yeah.
that you're saying the GLP-1 bypasses it, but really leptin is the issue.
Leptin is a problem. Leptin is part of the problem. And I don't necessarily know if like the connection of how leptin, off the top of my head, how leptin deals with satiety and hunger. I do know that the GLP-1, we do have receptors in the hypothalamus that are able to shut off that satiety signaling. I don't know what the connection is. I do know that like they're independent pathways. I don't know
Mm-hmm.
how they
Right.
necessarily work together. So that's definitely something I should definitely look up
Yeah,
and figure
it's
out because
super
no,
interesting.
it really is. I just the other thing is yeah, I don't know where I want to say that they have done studies where they tried to make drugs addressing the leptin
Yes, they
pathway,
have. They
but it
have.
hasn't just I don't know where the
It
like
didn't work on
hiccup.
humans. Like
Yeah,
the
well
it
there
was
you go.
really interesting. Like there's a study, and I can't, pull it out right now, but there's a study on mice
Yeah.
um where the the they could see the difference between the mice who were receiving leptin as
Yeah.
opposed to mice who weren't, and the mice who received leptin were losing weight.
Yeah.
And then they tried to move it to humans, didn't
And
work.
just yeah.
Just did not work. It was completely irrelevant.
Yeah.
So yeah, it's a really interesting topic. I would totally dive into it, try to figure it out myself.
Yeah.
But what you said about the support, the emotional connection, I think that my feeling is that
Hmm.
no matter how many generations of GLP-1 are going to show up, and they're going to show up,
Yeah.
it's happening.
Yeah.
Um, and no matter how um, clear the meal prep is, and
Yeah.
all the stuff that we should be doing, if you don't have a strong support system in place, if you're not going home to a strong support system,
Yeah.
if you don't reach out, maybe
Yeah.
really, what maybe you're not going home to, maybe you've got your cat, but also like reaching out and really
Yeah.
not being ashamed. That goes back to what you said in the beginning.
Yeah.
Your DMs are full of people saying like, yes, thank you. And that there's a reason, because people really need that support.
Yeah. Agreed. Agreed on all counts. Um, we are connected now more than ever through social media, but also seemingly disconnected now more than ever. Just, with the way we interact, online, which is all good and dandy. There's something to be said about actual having face to face time, that for a very long time, I just either didn't compartmentalize to try and get through medical training as fast as possible. And that was my number one thing. And looking back, it came with some sacrifices. Like I definitely, my relationships suffered at that cost. I don't regret it, but looking back and being able to tackle this hunger situation has allowed me to really start thinking about how can I do better to show up in other parts of my life. But yeah, I think probably having a little bit more social support, I could have, done a lot better with, so, but it is
And
what it is.
yeah, of course. And but you also said something so beautiful, on the whole, like, not dealing with this hunger thing
Yeah.
is allowing
Yeah.
for life to happen. That's what I'm hearing. Like,
Oh, yeah.
oh my God.
The amount of cognitive bandwidth that it would take for me to sustain at 150 pounds. I'm like 145 right now, comfortably post-op. And the amount of cognitive bandwidth it would take for me to even get down to 150 pounds naturally was just like nerving. Like I would bite my nails and kind of chew on my cuticles to try and pretend like the kitchen wasn't there, pretend like
Oh,
I didn't feel hungry. And then I'd feel guilty because it's like, you just have to have willpower, right? Like you just have to grind through it. And, I've dieted in the past to 130 pounds, and I would be up till 4 in the morning with my stomach growling. Like I could audibly hear my stomach growling and just tossing and turning because the hunger was so bad. And I was like, well, maybe this is the way, this is just something I have to deal with. And
mm-hmm.
I was such a zombie in medical school that like I failed anatomy. And so that was like a wake up call that like, okay, maybe this isn't going to work, or I'm just not going to be a doctor if I continue to try and, I'm 4'11. So
Starve.
like at 130 and 4'11, not really anything, spectacular in terms of getting lean, but holy crap, man, the signal, the food noise was so
Way up.
incredibly, yeah,
Yeah.
it was insane.
Wow. I am so happy that your life and you are showing up for each other.
Yeah, and I would love for that for other people, right? If I'm, was able to sort of grind through this, by the skin of like white knuckling through life, for the last 40 years, trying to take care of patients, trying to, be a great spouse, trying to be a good friend. Man, I'm sure there are other people who are white knuckling themselves through life and have found a lot of freedom with this medication. So I would hope that, if you were even thinking about it, to like go to your doctor and talk about it and just have that
Hmm.
conversation of whether or not this is, something that, might be right for you. I always encourage people like going and talking to your doctor about it is never the wrong answer,
Right.
in my opinion.
Going and getting
Yeah.
educated about
Yeah.
things that can serve you and help you is that really is, I think, what you and I are saying here. The message is, go get educated. It doesn't have to be a certain way.
Yeah.
There We live in a world with so many, so many, so many options
Yeah.
that go and reach out,
Yeah.
find out, get support. It's, yeah, what a great message.
Oh, thank you.
Thank you so much, Dr. Christle.
Ah, thank you so much for inviting me on here.
Hey, thanks so much for tuning in. And if this hit home, please share it with your crew. Likes, comments, shares, show your loved ones you care.
A Bodyholic production.